there, it's Laura at the Seniors Coordinating Society in Nelson. We are here today with Stephanie Moss, who has kindly agreed to talk to us a little bit about being a healthcare advocate for seniors. Could you tell us a little bit about yourself, Stephanie?
Sure, Laura. Thank you. My name is Stephanie Moss, and I'm a registered nurse. I'm also working with CHI, Canadian Health Advocates Incorporated, and I am a patient advocate. I've been nursing in the nursing role for about 12 years now in a variety of different clinical settings in various provinces and out of the country, and I've seen just how the system is working or not working and how certain people have fallen through the cracks and just not gotten the care that they need. Right. So in my role as a health advocate, I'm able to provide people with information and options and help them to navigate the system for themselves.
Well, I was going to say, you know, navigating the system, even if you are competent on a computer or you can travel to appointments independently, it's still confusing for people a lot of the time. So yes, that's why we're going to have a little chat today. So what are we talking about when we talk about being an advocate or advocating for yourself?
Right. As we age, it's really important that we learn how to advocate for ourselves. There may be more doctor's appointments, more specialist appointments, and just more involvement with the healthcare system in general. And to advocate for yourself, it's really important that you become empowered. Empowerment means becoming stronger, more confident, and having control over your life and claiming your rights.
Right. So if you weren't doing that, what could happen if you weren't in control or you weren't advocating? What are some of the things that might happen?
Well, medical language, for a start, can be quite confusing for people to understand. So it's really important that you ask for clarification and for information to be put in a way that you understand it. Arranging and keeping all appointments can be challenging, and research on your part, getting a second and sometimes third opinion might be necessary. Ultimately, you need to determine which type of treatment and course of action is going to be best for you.
So if you were to do all that, what are the benefits versus not doing that?
Well, knowing the system and understanding how it works really enables you to get the access you need and the care you need. And a lot of times it's about resources and finding out what's actually available to you.
Okay. And are there some tips on how a senior could be better at advocating for themselves or a loved one? Absolutely.
Firstly, I think it's really important that you know what you want and what you need. And then this can guide your research and gathering of information. It's important to ask a lot of questions, a lot of whys. So a lot of why am I taking this medication? Why has this test been ordered? Right. And then speaking up for yourself, a very important tip. Not beating around the bush, just being very clear about what you want, coming right out and saying it. And just a few tips for effective communication with your healthcare provider could be remaining calm, in control of your emotion, and just starting each conversation with respect. Right. Gathering support, so knowing who your support people are, who's around you, who's going to help. It's especially important if we get sick, that we ask for help and reach out. Right. And then I think it's really important that you have a plan. So prior to physician appointments or other appointments, you're just really organized. You have a plan in place with all of your main concerns and ideas and your questions written down, and then that can just sort of help guide the appointment, as well as you could have a third person come to your appointment and just make notes for you.
Take notes. Yeah. So it's so easy to forget what the doctor said, and while you're having the emotions, and so forgetting things is very, very easy too. But you know, what are some of the rights that people might not be aware of that they have in the healthcare system?
Right. Knowing your rights is the foundation for all health advocacy. Knowing these rights enables you to make informed decisions and good decisions for yourself. So there's a few. You have the right to be fully informed of all treatment options. You have the right to the recognition of your substitute decision maker or representative. You have the right to an advance directive, which is a document that helps guide care. You have the right to a second opinion at any time. You have the right to pain and symptom management, the right to refuse treatment, the right to end your life, and the right to an assisted death if you wish.
Wow, that's a lot.
A lot of rights.
I think some of the things would need to be expanded upon. So where could people go to, get more information, say if they wanted to have information about assisted death, for example? It's not just a matter of you can do this if you want.
There is a strict criterion for it, and you should have a chat with your physician about that, and they can help guide that.
Okay. And when you mentioned about the advanced directives, so would that be something that someone had when they went into care or into a hospital situation, or what does that look like?
Well, an advanced directive we recommend you have in place before. So it's just about having open discussions with your family and coming up with sort of having an open communication about your beliefs and what you're wanting your care to look like.
For example, I don't want X. When you're talking about your desires or what are some of the things that people could choose? For example, I don't want to have a priest at the end of my life, or I don't want any religious paraphernalia in my room, or what are some of the other things that people have on their advanced directive?
Right, so just that they might not want CPR.
Okay.
They might want just comfort measures, so it's just sort of a document that can help guide their medical treatment.
So are there many of those types of documents?
It's a non-legal document, but it is signed by 2 witnesses, so it has a lot of sort of weight behind it.
So when should a senior start to think about getting an advocate or, getting a service or having someone with them?
We can help when people have minimal or no sort of social support systems. We can really help them as we listen, and we can provide support for those people, as well as we can advocate for people who are frustrated with the system and they're just not getting the access on the answers.
So common. I mean, when I have people in here and they say, well, I don't have access to the computer and they want me to fill out these forms and I don't have a clue about what this medication means, and it's not just about your pharmacist, but also what you want in the future, isn't it? Yeah,
absolutely.
For sure. So can you talk about the different kinds of planning and why it's important, not just for finances, but for your health?
Yeah, so advanced care planning is sort of the process by which you make decisions about the care you want to receive should you be unable to speak for yourself. So it's not leaving your families to scramble in times of crisis.
Okay.
So to have everything all organized for them so that they can, focus on other more important things at the time.
Absolutely.
Yeah, remember that an advanced care plan should be voluntary, and you should never be coerced into filling out any of these documents.
Okay.
And the documents can change at any time.
Oh.
So as your health changes or your beliefs change around your health, the documentation can reflect that and change as well.
Okay, so that's a really considerate thing, if you don't want to do everything for yourself, to think about your loved ones. That's and it's helpful for them too, to know if you can't speak that this is what you really wanted.
Absolutely.
That's really key. So, yeah, well, I appreciate you coming in today, Stephanie. Is there anything else you would like to mention?
No, I just thought we're enjoying helping people in the community and just getting them in touch with the resources. A lot of times people don't know what's available.
No, it's not common knowledge, and I'm really glad that you came in to talk to us today about that. So thank you very much, Stephanie. Thanks a lot.
Okay. Thank you.
Hello, I'm Andrew Brown with the Nelson and District Seniors Coordinating Society. We're so grateful to retired nurses who founded and run the Elder Abuse Prevention Program. There are far too many instances of mistreatment of older people, and these ladies will provide us with some valuable information on the topic.
So what is elder abuse or neglect? It's the misuse of trust or power over an individual. So this can be a family member, or it can be someone you come to trust, or even a stranger. Now the types of abuse that we see are emotional or psychological, physical or sexual, and financial, including fraud. And that's the most common. So 1 in 12 seniors experience financial abuse. So the types of neglect are either caregiver neglect, which could be a family member or a caregiver, or it could be self-neglect.
So caregiver neglect may show up as someone that's not providing their loved one with adequate nutrition, bathing, refusing to allow neighbors in for visits, friends. Self-neglect is sort of the individual that you see that might be hoarding or refusing to come out of their home, not bathing, not eating properly for whatever reasons.
About 1 in 12 older adults experience abuse, and 2/3 of older adults that are abused are women, so of the older adults. So there were 4 of us, retired nurses. We saw a need for community support in this area. So in 2008, we founded this association, which is the Nelson Area Elder Abuse Prevention Program. We created the manual publication in 2009 and distributed 80 copies of it. So now it's online, and we've also have a resource center.
So the Nelson Elder Abuse Prevention Program has several prongs. The Resource Center is probably our primary prong. We are here every Wednesday from 12 to 2, but Laura, the front office person, takes appointments for us and can be reached at the phone number 352-6008. Here at the Resource Center, we try to assist people who are concerned about an abuse situation or have questions whether this is truly an abuse situation or neglect or self-neglect. We help to sort that out with them, and then we do not intervene, but we do assist and support them to find other resources. There are a number of legal channels, community channels that are legally obliged to assist a person who has a concern about abuse or neglect. So that's the primary thing we do, is most of our interactions with the public are in regards to specific situations. We also have conducted a number of community outreach programs where we talked initially about abuse and what that looked like. Then we progressed to what individuals can do as they age to help prevent themselves from being more susceptible to abuse. And out of that program grew the Personal Advanced Planning Program, which now the Seniors Coordinating Center has taken on, and it does assist people particularly in completing the Healthcare Representation Agreement. Representation Agreements 9 and 7, which allow you as an individual to dictate what you want to happen to your health, for your health care, should you become unable to express that. Our last area is advocating for seniors against systemic abuse. And this is a little harder to define, but it's when things are going wrong within a care facility, within a senior's housing situation, where seniors are feeling powerless, because remember, as Christy spoke of, it's a misuse of that sense of power and authority over an older person. And so we have had probably a half a dozen situations that we've supported individuals in trying to restore a better balance of that power for someone that's been in a systemic abusive situation.
So we've been working with and developing networks about abuse prevention within the service and the professional community. So community resource networks, advocacy, city police, RCMP, banks, financial advisors. We've had providers of care meetings where all the financial institutions got together with the representation agreement people and making sure that we're protecting people's finances. We've had a hoarding and harm reduction workshop, which was good. We always do what's called World Elder Abuse Awareness Day, which is June 15th, and we join with the CRN, which is Community Response Network, for that. Basically, we've done a lot of education. The education helps us with prevention of abuse. Then we look at early intervention, and as Gail said, early intervention is really important for making sure that the abuse doesn't get worse and is more difficult to deal with. And we've looked at the whole community response, awareness and responsiveness situation. We also have an online manual which we're trying to do paper-free. So anyone can go online, and the first 20 pages of the manual have a really good descriptor of what is abuse, and you can look at it and figure out what's going on and if someone could help you with it. And in the following chapters, there's who can help you. So the chapters are divided into education, prevention, early intervention, and the whole manual and our program is for community awareness and for responsiveness to situations that we're in.
The earlier there's an intervention, the less likely the abuse is to become more severe. People generally want to help someone. They're not intentionally harming someone. Often they don't even realize that what they're doing is a form of abuse, and that there are supports out there for the abuser as well as for the person being abused.
Going to the doctor, the dentist, it's all part of taking care of your health. Visiting the eye doctor, also very important. Eye exams at every age and life stage can help keep your vision strong.
So for kids, we want to see them every year, starting when they're around 6 months old. There's some very early things that we can detect and pick up. And then we want to see them every year through school. Once you hit 19, if you don't have any health, systemic or ocular concerns, we want to see you every 2 years. Once you hit 65, again, we want to see you every year, just because there's so many things that can change and concerns that can pop up. So the biggest thing that we see is probably cataracts. We're all going to end up with cataracts if we're lucky to live long enough. It's not a matter of if, it's a matter of when. So cataract is cloudiness of the lens inside the eye. We have a lens that sits inside of our eye behind the iris, the colored part, and over time that gets a little bit cloudy. Most people are looking at cataract surgery sometime between 60 and 80. There are different medications, even conditions that can make cataracts progress a little bit more quickly. Some of the other things that we're looking for are glaucoma, which gives you slow progressive visual field loss because the pressure inside the eye is too high for what the eye can handle, and actually damages the optic nerve. The big concern with glaucoma is that the visual field loss is so slow and it's painless that you don't notice how much is gone until it's almost end stage. Once you've lost visual field, it can't be regained. We can pick it up way quicker clinically than you're ever going to notice it in the real world walking around. Glaucoma is very treatable now. We have great options with different drops to bring the pressure down inside the eye. The goal is that we can slow the progression so much that you keep good vision for your whole natural life. The eye is the only place in the body where we can see the small blood vessels non-invasively. We can pick up early changes. We can see leakage of blood or other fluids from conditions like diabetes. We can see changes to the blood vessels with uncontrolled high blood pressure. Sometimes we can even pick up in the eye that there's high cholesterol concerns. The important thing is just being healthy generally. Healthy diet, lots of leafy greens, spinach, kale, dark fruits and vegetables like blueberries. The high antioxidants can actually help to potentially prevent macular degeneration. Not smoking. Smoking is the biggest risk factor that we know of that we can do something about for macular degeneration. And then wearing sunglasses. There's UV even on a cloudy day, and having that protection around your eyes is very important. For more information or to find an optometrist in your area, you can go to bc.doctorsofoptometry.ca. They have a great website with lots of different tips about different eye conditions and what you can do to keep your eyes healthy.
Here's a group of active seniors showing us why it's important to keep in shape and how they like to do that. The Learning in Retirement Walking Group joins us for the next segment.
I started 10 years ago in May, and the main reason was because my husband died of lung cancer and I felt lonely. 4 people they started was from swimming pool, and one day we said, okay, let's go walk. And what day? They said, okay, Wednesday. And since this time, every Wednesday we walk, and we developed a really fantastic group. Originally it was only 4 people, and now it's 35. During the winter we ski, and also some of us try snowshoeing.
I saw Liba's ad way back 9 years ago when I was going to Aquafit, which I was doing that 3 times a week. So this kind of broke it up, going on a Wednesday for the hikes, and it also kept me agile and in shape.
I love to be with these people. I love company, and it is so nice to go hiking and in company. I'm on my own, I live on my own, and I don't like to go hiking by myself.
I definitely think it fills your loneliness of companionship. I'm single, and I moved up here and live alone out on acreage, and it's just, you know, it's just, I can't stay in. If I've got this to come to, I'm here in any place, anytime, and it's once a week. And as you're walking along the trails, you share stories, and some very compassionate stories, and you're supporting one another as well. Just a pair of ears. And then we go have lunch after at somebody's house, usually every week, or in the park that we're in, and it's just great.
It's mostly people who retire and they want to be active because they are afraid to do themselves, and we have also fun, you know, and we really developed the friendship, and I think we love each other, yeah.